Your voice, your opinion, your community. Fact TV, free speech protected.
Hello, and welcome to the Art of Being Human. You know, occasionally I come across a news story that's so important that I want to take some time and talk to you about it because it's relating to what I'm teaching or it's relating to what I'm going to teach. Now, a news program came on and I want to talk about it because it focused on a certain person who was a star and became an alcoholic and what she lost and how she's trying to get back. Since we will be doing alcoholism, I decided to switch some of my scheduling and I'll do alcoholism and then go back to the use of drugs when alcoholism is done. Well, the news story concerns Wendy Williams. If you're older, you remember her. If you're younger, you might not. Wendy Williams was a star talk show host. A lot of people loved her. A lot of people listened to her on television. She was on television every day. She loved it. She did a good job with it. I'd catch it once in a while, not too often because I'm not into talk shows, but once in a while I'd peek in. On one show, they were using costumes, and she got up to go somewhere to do something, and all of a sudden her face changed, and all of a sudden she was shaking her hands, and she passed out. She fainted right on stage. Someone got up and carried her back, and then carried her back to where she could be revived. She came back on the show, and she said, "Yes, I have fainted. However, it's because I was overheated in this costume." For some reason that day, they were using costumes. I don't remember what it was about, but she was in costume, and she just fell flat on the floor. Now, she had some health issues. She was diagnosed with Graves' disease, and she continued to do the show, but every so often she'd have to take time off for health reasons. Then she started drinking. So this is about alcoholism. She started drinking and it overtook her life. She became really difficult to handle. She was screaming at people. She was yelling at people. There was a recent documentary on her about 3 hours long, and I watched it because I was fascinated by it. And after she fainted and got back up and emptied and then went back to the show and completed the show, she thought she was all right. So she started drinking, and she went into rehab, and then she had more problems drinking. It got to the point where she had to take considerable time off, and all she wanted to do was lay in bed all day and drink. But there were some other health issues that were involved. So recently, and it was just on television like yesterday, which is why I caught up with it, she has been diagnosed with aphasia and dementia. Now, that's serious business, either one of them. Aphasia, which I won't go into much as we teach this because it wouldn't be of value to you, but aphasia has to do with the way people use words. Can they talk right? If you ask them a question, can they respond using correct words? Do they get mixed up in what they say? And evidently she does, because people were talking to her and she wasn't making any sense in what she was saying. She was using the English language because she just wasn't making any sense in some of the things she said. It didn't seem to have any relevancy. So aphasia can be a very serious thing. People can't use their words right, or they don't use their words, or they don't recognize their words. That's bad enough in itself. But what is even maybe more troubling is the fact that she has dementia. How did she get dementia? We know it's a loss of cognitive functioning, that people get to the point where they can't function, and she got it by drinking. Because of her drinking, she has dementia. Now, I want to mention a little bit about dementia. So many people feel that if you have dementia, then you're Alzheimer's patients, but that's not necessarily true. In different illnesses, dementia presents in a different kind of way. Alcoholism has its own type of dementia. Parkinson's has its own type of dementia. Various illnesses have dementia as part of their symptoms. Now, in the end, I guess it doesn't make much difference. You're going to be just as disabled whether you have Parkinson's or whether you have something else and get dementia. I know people with Parkinson's that never get dementia, so it's not a surefire thing you're going to get it, but some people do. With alcoholism, that presents with dementia as well. The dementia will be presented in a medical sense differently depending upon the illness that you have. With her, she got so that she was drinking so much she could no longer function as a normal person. And what happened is that she got dementia. So her recent diagnosis is dementia and not being able to talk right, aphasia. So it's what I am concerned about is the things that she has lost by drinking too much and getting dementia. She lost a lot of things along the way. Her family is very supportive. She has to have somebody take over her finances. Somebody has to act as a financial director for her. Her family was willing to do that, and they did it for a while, but then it was taken away from them. And I don't know the circumstances as to why it was taken away, but it was taken away. What you have to remember is sometimes in the healing process, a person has to be separated from their family because the family interferes with the healing process. I'm not sure that's the case here. There's no mention of that, and I'm not sure that that's the case anyway. But she is in a rehab center. Her family doesn't even know where it is. She can call them, they can talk on the phone, but they don't advertise where she is. And her family says they don't know where she is. Maybe she is not allowed to say. But she is in rehab. She's been in rehab. They say she's doing better. She's sounding better. She's obviously not drinking anymore. The problem is this: can you heal from dementia? For dementia, you can't use your mind well, and it gets worse and worse and worse, and it's progressive. And sometimes we don't even know where it's coming from. There is a man, I mentioned him once, maybe on one of the first shows I did. He had a business, he was doing fine, and suddenly one morning he lost it, his brain would no longer function. He went for years in a wheelchair, hardly able to talk, not understanding anything, not able to dress himself. He was just like a person who had dementia and wasn't able to take care of himself at all. And then one day, years passed, I was introduced to him. I was introduced to him in his wheelchair state. I'll call that his wheelchair state, because he was in a wheelchair and he couldn't walk and he couldn't do anything. He wouldn't have known who I was. I spoke to him. He waved his hand a little. That was the end of that. And then a few years later, all of a sudden, he got up one day and he started getting dressed. Why are you getting dressed? Well, so I can go to work. He was planning to go to work at the job that he had. He had absolutely no memory of all those years that he was in a wheelchair. He said, "Why is my wife looking so old?" He said, "Well, you're the same age as she is, and you're older. For all these years you've been in a wheelchair, not able to function." He couldn't believe it. He couldn't remember it. He thought he was going to get up and go to work. No memory of what happened in those years where he had dementia, and nobody knew why. Nobody also knew why his brain started working again. It wasn't like he was on drugs. It wasn't like he was drinking. And so there's no knowledge as to what actually happened to his brain. Now, in alcoholism, you can get brain dementia, and it gets worse and worse and worse. Where she is an alcoholic, although not drinking and feeling better because she's not drinking, can she get well from dementia? I have my doubts about that. But the reason I wanted to stop talking about alcoholism is the fact that this is what she is. She is an alcoholic. She's getting better from the alcoholism, but can she recover from the dementia? I don't know. Can she recover from the aphasia? I don't know. So she's not in great shape, but I want to bring this out. There is in dementia personality changes, yelling at people, no compassion, treating people like around her like they're her slaves, and she did all of that, and becoming very, very, very self-absorbed, wanting to have all of the attention, and having no self-control in terms of what they're drinking. It was like everybody should serve her. She does have the memory that as a child, all she wanted was attention. She wanted more attention than anybody else. It doesn't say her parents didn't give her enough attention, but she remembers that she wanted to be the center of attention all the time. Now, dementia is usually permanent, and not all people with dementia have is the same symptoms, but dementia, in the end of it, it's all going to be completely disabling. Whether she can recover, I don't know. There are various diseases that have dementia, and I mentioned Parkinson's, heart trouble, you can get dementia, diabetes, at some point you can get dementia, and your functioning gets less and less and less. So we have to think that this is an illness. Now, when I was in rehab, I was recovering from foot surgery. This is not so far back along. This is this past year. I had extensive foot surgery. I went into rehab, not because of drinking or anything other, but to heal my foot. And one of my roommates, because they kept changing, had Alzheimer's. And I was there for 5 weeks. And the first time I saw her, she was nice, she was controlled. I talked with her, and I thought, this is going to be a good experience. But then she started getting failure. She got worse and worse and worse. And by the time 5 weeks was up that I was there for healing for my foot, for rehab, she was screaming. She thought I was awful. She thought I was responsible for actually getting her there. She thought that I was trying to get her husband away from me, that I was trying to steal him away from her. She hated her husband. He wasn't good to her. She was going to walk out. She wanted me to get her out of the facility, which of course I couldn't do. And she wanted me to do that. She was kind of attached by some kind of a cord. They kept an eye on her. And she started trying to cut the cord so she could get out. She said terrible things about her husband, who was a really very nice person, and so she got to the point where she was unmanageable. She threatened to have me killed because I was stealing her husband, and she tried to take things away from me, and they actually moved me from where I was the last week of rehab to another room because she was getting too dangerous to handle. She was going to have to be permanently taken up to a unit that handled patients with Alzheimer's. And that's what her history was. Now, for Wendy Williams, I don't know if that dementia is going to get worse and worse. It's not necessarily Alzheimer's. You can get dementia from other sources and other illnesses. So people who think that if you have dementia, that automatically you are going to be Alzheimer's, that's not true. But it can go back to the worst that you can imagine in terms of behavior. So I was moved so that I wouldn't have to see her. She found me. She started coming in. She said, I can't live here if you're not here. But she was yelling at me, and I was the cause of all of her problems. And she had no sense of what she was saying, didn't know what she was doing. She would strip and wouldn't be, I would wake up at some time and she was standing in front of me, no clothes on. She would start walking in the hall. I used to try to get her back, but at the point of 5 weeks, I couldn't use my foot very much. And I also wanted them to see how bad she had gotten. At some point, she asked for water, all kinds of water. She'd drink a glass after glass after glass of water. And she would ask me, where can I get water? So I pointed her to the bathroom and the cups and all of that. Drink, drink, drink water. And finally, I snagged the nurse and I said, do you realize how much water she's drinking? And have you ever tested her for being diabetic? It's one of the symptoms. And lo and behold, they didn't, but they did, and she became diabetic. They started giving her shots, and she complained. You gave me a shot this morning, why are you giving me another one? She didn't understand that you have to take many shots. Well, I'm going to close it off here. We're beginning to run out of time. But alcoholism, I'm going to be going into it because of the news story, and it's so much in the front of New News. So we'll close it here. Thank you for watching. Until next time.